Ladies and gentlemen, please welcome cardiologist Dr. Peter McCullough.
Thank you. Yes, there is a doctor in the house. A real doctor, and I'm not alone. And I'm not alone. We've had 2 years of this, and I can tell you, as a citizen and as a doctor, I have been disappointed, very disappointed. Doctors in my circles have been disappointed. I have learned 5 things about this infection and this pandemic crisis that have been learned by all doctors who are caring for COVID patients and managing through them. They are the following. First, this virus is spread from a symptomatic person to a susceptible person only. There is negligible asymptomatic spread. So that means, number 2, there should have never been any asymptomatic testing of large groups of people done on a routine basis. That means students, employees, people traveling were unnecessarily tested. The FDA does not clear any of the tests for this. The World Health Organization says don't do it, and none of the regulatory bodies endorse it. Testing is reserved for only acutely symptomatic individuals. That's it. We have to follow the clearance of these testing products for that reason. The third point is that once someone gets through the illness, that they have a degree of protection, a degree of immunity, natural immunity, that gives them robust and durable protection from serious outcomes of a second infection, which can now occur with the Omicron variant, which broke through natural immunity. So this is very important. How many of you in the room have been through COVID-19? Let's see a show of hands. 70%. 70%, you can be assured that you're safe, you're secure, you are free to go about and live your life with no restrictions, with no mandates, with no encumbrances. For you, this pandemic is effectively over with. It's over with. And because there are so many of you, and so many of us who've been through the illness, the emergency phase of this pandemic is over with. It's over with. The emergency is gone. The crisis is resolved. There will be some residual cases, and skilled doctors will be able to handle these cases with now an array of effective therapeutics that we have at our disposal. I can tell you that point number 4 is COVID-19, the illness, SARS-CoV-2, the virus, has always been treatable. It's always been treatable. And the best doctors, using the best drugs at hand in combination, have found ways of helping people through the illness to avoid 2 bad outcomes: hospitalization and death. And we needed leadership in Washington to say that, to say there are 2 bad outcomes, hospitalization and death, and that we're going to bring the best and brightest doctors into Washington who are learning how to treat the illness and put together programs, protocols, and approaches to help our population get through the illness, particularly our seniors. Our seniors are the ones who have suffered with COVID-19. And what we saw out of Washington was completely unacceptable. We saw a chill on any attempts to treat the virus early. We had headwinds in trying to use drugs in combination. We've even had difficulty getting access to emergency authorized, approved agents that are safe and effective in helping people get through the illness. Importantly, the monoclonal antibodies, which I've used in my practice for a year, and they're safe and effective, and they've been a great product of Operation Warp Speed. The fifth and final point is that the COVID-19 vaccines, as they exist today, Pfizer, Moderna, Johnson & Johnson, outside the United States, AstraZeneca, we have more coming. But the ones that we have in the United States today are not sufficiently safe enough, nor are they effective enough to have mandated upon us in our lives. And importantly, because people have in fact reported, and the CDC is holding over 1 million of these reports now, sadly over 1 million Americans have been injured as a result of COVID-19 vaccination, and sadly, thousands have died afterwards. We deserve and have always deserved a full, fair, and thorough external safety review of the vaccines. We haven't had it, and the stakeholders in Washington who have had governance over our pandemic response have failed miserably in vaccine safety and efficacy and the path forward. But the virus has outmutated all of the reaches of the vaccines, and in many ways, the virus has been in charge the entire time. Thankfully, we're down off the back end of the Omicron curve, and I believe at this point in time, we can manage our way out of it. Final thought. You have a circle of medical freedom that you control, and that's linked to your circle of social freedom and your circle of economic freedom. Don't let the circle of medical freedom get broken or fractured. Everything else will fracture. You cannot have something forced into your body against your will, whether it be a pill or an injection or any other medical procedure. The decision is in your hands. It's in your hands. Take it, and together, let's close out this crisis. Thank you.